All right, let's dive in. Today, we're tackling something that affects millions of men.
Yeah, it's a big one.
It is. We're talking about erectile dysfunction,
Hmm.
or ED for short. And, you know, we're going deep on this one, bringing in the heavy hitters, like
Big guns.
exactly the National Institute of Diabetes and Digestive and Kidney Diseases. So the NIDDK.
Catchy name.
It is. And we've got the American Urological Association, the AUA.
The experts.
The experts. By the end of this, you're going to understand ED so much better. You'll know the treatments,
Everything.
everything. Plus, this is personally relevant to me, so
Mhm.
I'm excited to really get into this one.
Let's do it.
So, first things first, what exactly is ED?
Well, the NIDDK keeps it pretty straightforward.
Okay, how so?
ED means a man can't get or keep an erection firm enough for sex.
Simple, straightforward. But the AUA guidelines kind of point out that this is really an issue with the arousal phase of sex. So it's
That's
more than
right.
just the physical, right?
Yeah.
It can impact desire and orgasm as well.
Right.
Now, something
Mhm.
that really caught my eye in the AUA guidelines is that ED, it's not always a purely sexual problem.
Yeah.
It's like a canary in a coal mine.
Exactly.
It can be a warning sign,
Oh, absolutely. A risk marker.
a risk marker. Okay, so like what kind of things?
They specifically mention cardiovascular disease, so CVD.
Okay, so we're talking heart attack, stroke,
Serious stuff.
serious stuff.
Yeah.
So are you saying if a guy's having trouble, downstairs, his heart might be trying to tell him something?
Potentially.
Wow.
Because when you think about it, a lot of the risk factors for both ED and CVD are the same.
Oh, yeah, like lose.
Smoking, diabetes, high blood pressure, even just being out of shape can increase the risk for both.
Okay, so ED could be like a heads up years before something worse might happen.
Up to 5 years, they say, especially for younger men.
Wow.
So it's not something to take lightly.
Yeah, especially if you're a younger guy and you just think, whatever, it's fine.
It might not be.
No, it might be a sign of something more serious. Okay, so let's say a guy does go to the doctor. What happens then? How do they actually figure out what's going on?
So the AUA, they recommend a pretty thorough evaluation.
Okay, break it down for me.
So first, a detailed medical history.
Makes sense. Get the full picture.
Exactly. So they'll ask about your overall health, any medications you take, your lifestyle.
Of course.
Then there's the physical exam.
Yep.
And they'll probably order some lab tests like checking your hormone levels, cholesterol, blood sugar.
To rule out any obvious medical issues.
Exactly.
But if those all come back normal?
Then they might use some specialized questionnaires.
Oh, like what?
2 main ones, the IIEF and the SHIM.
Okay.
It's basically a set of standardized questions that really help the doctor understand, how severe the ED is, track how treatments are working, that kind of thing.
So it's not just a subjective, yeah, doc, things aren't great.
Right, it's measured.
It's actually measured.
They can also do some specialized testing, like a penile duplex ultrasound.
Now we're getting a little technical. What is that?
Imagine like a sonogram, but for your penis.
Oh, okay.
It uses sound waves to check blood flow.
So checking if the plumbing's all clear.
Exactly. And they might do a test called ICI, which is where they inject medication directly into the penis.
Okay, not for the faint of heart.
Right. But it can help see if it triggers an erection.
Okay, and we're focusing on medical stuff, but the AUA is also really big on lifestyle.
Absolutely.
What kind of stuff are we talking about here?
So there's tons of research showing that healthy changes can actually really improve ED.
Really? Okay, what specifically? Because I think a lot of guys would rather do that than jump to pills or something more drastic.
Right. Studies have shown even simple things. Eating a healthier diet, getting regular exercise, losing weight if you need to, can make a big difference.
It's about taking care of yourself.
Yeah, the whole package.
Not just what's happening below the belt.
Exactly. For example, there's research on incorporating olive oil and nuts into your diet.
Oh, like the Mediterranean diet.
Exactly. And they're seeing noticeable improvement in erectile function within weeks.
Really?
Yeah.
Wow, that's a good takeaway.
Yeah.
It makes you realize even small changes can have an impact. But let's be real, some guys are going to need more than lifestyle changes. What does the medical treatment landscape look like?
Well, it's actually quite diverse.
Oh, good.
Which is a good thing, because what works for one man might not work for another.
Exactly.
The AUA really emphasizes shared decision-making, so between the patient, the doctor, and ideally the partner as well.
So it's a team effort.
Yeah, it's not just the doctor saying, this is what you're going to do.
Okay, good. I like that.
Working together to find the best treatment path.
Okay.
And what's really interesting, a lot of men might think they have to start with the least invasive and work their way up.
Right, right.
Any treatment can be considered a first-line option.
Oh, okay. So let's talk about those options. Let's start with, the one everyone's heard of, oral medications.
Mhm.
What's the deal with the little blue pill?
Those are the PDE5 inhibitors, things like sildenafil, tadalafil, vardenafil.
Viagra, Cialis.
Exactly.
Okay. And how do they work? What do they actually do?
They essentially help relax the muscles in the penis, which allows more blood to flow in, which is essential for an erection.
Makes sense.
And the AUA analysis shows that these medications have pretty similar efficacy.
So they all basically do the same thing.
Yeah, maybe with slightly different timings or side effects.
Yeah.
Here's a fun fact from the AUA data. Doubling the dose doesn't double the effect.
Oh, really? So more isn't always better?
Nope. The dose response is nonlinear. It's important to work with your doctor to find the right dose for you.
Of course. Now, I know any medication can have side effects. What are some things guys should be aware of with these pills?
The most common ones are headache, flushing, indigestion, back pain. Some guys get a stuffy nose or muscle aches.
Okay, nothing too scary.
Nothing too major, but yeah, good to know.
So that's the pill route. What about other non-surgical options? What else is out there? Okay, so we've talked about the pills, but what if those aren't working?
Right.
What else is there before we get to surgery?
Well, there are a couple of other interesting non-surgical treatments, like
Right.
the vacuum erection device, the VED.
Now, those always sound a little intense. How do those even work?
They're actually pretty straightforward. You create a vacuum around the penis using a cylinder and a pump, which draws blood into the shaft and causes an erection.
Okay.
And then you slip on a constriction band at the base of the penis to maintain the erection.
So it's like a bicycle pump for your,
You could say that.
Hmm.
But despite the maybe awkward image, research shows VEDs can be pretty effective.
Really?
Yeah. And they're a good option for men who can't take the pills for whatever reason.
Interesting. So a little bit of manual labor involved, but it gets the job done. What else is there?
There's also intraurethral alprostadil.
Say that 3 times fast.
I know, right? It's a mouthful.
It is.
Basically, it's a tiny pellet of medication that you insert into the urethra.
So into the tip.
Yeah, the opening at the tip of the penis.
Okay, so not for the needle phobic.
Right. It's a bit more hands-on, but it can be effective for some men, especially those who haven't had success with other options.
Okay, and then finally, we have injections.
Yes.
Those sound even more intense.
These are called intracavernosal injections, ICI for short. It involves injecting medication directly into the erectile tissue of the penis.
I can see why some guys might be a little hesitant, but are they effective?
They are actually, yes, highly effective. And the cool thing about ICI is that you can kind of customize the medication combinations
Oh, really?
to find what works best for you.
So a little more involved, but potentially more tailored to the individual. All right, so we've talked a lot about these non-surgical options, but what happens when those just aren't enough? Is surgery the next step?
For some men, yes, specifically penile implants.
Implants. Okay, that's serious territory. Let's break that down a little bit.
Sure, so there are two main types, inflatable and malleable.
Okay.
Inflatable implants give you the ability to control when and how long you have an erection.
How does that work?
They have a pump in the scrotum that you use to inflate the implant cylinders in the penis. Malleable implants, on the other hand, have bendable rods inside, so you can position the penis as needed.
Wow. So it's like high-tech versus low-tech. But either way, we're talking about something permanently implanted. I imagine there are some risks that come with that, right?
Absolutely. Like any surgery, there are potential complications.
Okay.
And the AUA guidelines are very clear about discussing those risks and benefits thoroughly with your doctor before deciding on implants.
Of course. What are some of the things that could go wrong?
Infection is a major concern with any implant surgery.
Well, yeah, you're putting something foreign into the body.
Exactly. So they take lots of precautions. Sterile techniques during surgery, antibiotics, monitoring you closely afterwards. The implants themselves are often coated with antibiotics to help prevent infection, too.
So it sounds like they're pulling out all the stops to keep things clean and safe.
Yeah.
Are there other potential complications besides infection?
Sometimes you can have mechanical issues with the implant itself, though that's less common with the newer devices. And there's a small risk of erosion.
Erosion.
Yeah, where the implant could wear through the surrounding tissue.
Okay, that does sound scary.
It is, but it's important to remember it's rare.
Yeah.
And surgeons are well trained to handle those complications if they do happen.
So the key is to have a really honest conversation with your doctor.
Definitely.
Understand the risks, The benefits, the whole 9 yards.
Right. But for a lot of men who haven't found success with other treatments, those risks might be worth it.
Okay.
And studies show that men who get implants generally report very high levels of satisfaction.
So it can be a game changer.
It can be.
Okay. That's good to hear.
Hmm.
Now, what about that other surgical option we mentioned earlier, the penile arterial reconstruction?
Right.
Is that something a lot of guys could benefit from?
Not really. It's a much more specialized procedure, usually only considered for younger men who have a very specific type of ED,
Okay.
caused by blockages in the arteries that supply blood to the penis. So,
Not your average ED.
exactly. And the success of the surgery really depends on the age of the patient, the location and severity of the blockage, their overall health, all these factors. It's not something you jump into lightly.
No, it sounds like it's reserved for pretty specific cases.
Yeah.
Now, I know we still have a lot to cover, but I'm curious about the future of ED treatment. Are there any exciting new therapies on the horizon?
There are always new things in the pipeline.
Right.
A couple of the big areas of research right now are shockwave therapy and stem cell therapy.
Shockwave therapy, like they use for kidney stones?
Same idea, but using much lower energy waves.
Oh, okay.
The thinking is that these waves can stimulate new blood vessel growth in the penis.
Fascinating. And what about stem cell therapy? How does that fit in?
Stem cell therapy is all about using the body's own repair mechanisms to regenerate damaged tissue in the penis.
Wow. That sounds almost too good to be true.
Mhm.
But imagine these therapies are still pretty experimental at this point.
Right, they are. Both shockwave therapy and stem cell therapy are still early in the research phases. The AUA is pretty cautious about their use.
So not ready for prime time just yet.
Not quite.
But it's exciting to know that there are people working on new, better ways to treat this.
Absolutely. That's one of the key takeaways from this deep dive. ED is common, it's treatable, and there's no need to suffer in silence. There's help available, and there's hope for the future.
I love that. Okay, before we get too ahead of ourselves, we still have one very important aspect of ED to discuss, and that's the psychological and emotional side of things.
You're absolutely right. We focused a lot on the physical and the medical, but it's crucial to remember that ED can have a really profound impact on a man's mental and emotional well-being and on his relationships.
So, in the final part of our deep dive, we're going to delve into that often overlooked but crucial aspect of ED.
We are. We'll explore how ED can affect a man's self-esteem, his relationships with partners, his overall sense of himself.
And we'll talk about what resources are available to help men and their partners cope with the emotional challenges of ED. Okay, so we've covered a lot of ground, the physical stuff, the treatments, but ED, it's not just about plumbing. It can really mess with a guy's head.
No, you're right. The psychological and emotional impact is huge, often underestimated.
It's not just, oh, I can't have sex. It's what that means for you,
Yeah.
your sense of masculinity, your confidence, relationships.
Exactly. It's all tied in. The AUA guidelines, they actually emphasize this, taking into account a man's background, his beliefs about sexuality, the dynamics of his relationship, all that plays a part.
So it's not just a solo journey. The partner's on this ride too, right?
Absolutely. ED can really strain a relationship. You've got frustration, guilt, feelings of inadequacy on both sides. Communication is key.
Yeah, communication is key in any relationship, but especially with something this sensitive.
Right.
So what are some of the psychological things that can actually contribute to ED in the first place?
Well, we live in a stressful world, right?
Yeah, 24/7 news cycle.
Exactly. And stress can wreak havoc on our bodies, including our sexual function.
When you're on edge all the time. Hard to relax and get in the mode.
Exactly.
What else?
Anxiety and depression are also big culprits.
Oh, yeah.
They can interfere with the brain's signals that are needed to trigger an erection.
That mind-body connection is powerful. And I imagine that actually experiencing ED can create more anxiety, and then it's just a vicious cycle.
Oh, yeah, absolutely. Performance anxiety is a huge issue for a lot of men. They start worrying about whether they'll be able to perform, and then that worry itself can sabotage their efforts.
It's like a self-fulfilling prophecy. Are there any other psychological or emotional things that can play a role?
Relationship problems, for sure. If there's conflict, resentment, lack of communication, all of that's going to affect intimacy and sexual function.
It's all connected, right?
It is. The physical, the emotional, the relational, it's all one system.
It is.
Mm-hmm.
So what can a guy DO if he's feeling overwhelmed by all of this? Where does he even start?
Honestly, talking to a professional is often the best first step. Therapists, counselors, specialists in sexual health can be so valuable.
What kind of things would they actually work on in therapy?
It really depends on the individual. But for guys dealing with performance anxiety, they might focus on relaxation techniques, mindfulness exercises, or cognitive behavioral therapy.
So giving them tools to manage the anxiety.
Exactly, breaking that cycle.
And for couples who are struggling.
Couples therapy can be amazing. It's a safe space to talk openly about their needs, their concerns, work through any underlying issues.
Yeah, finding ways to maintain intimacy even when ED is a factor.
Exactly.
That's important. Any other resources you'd recommend?
The AUA website is fantastic. Tons of information for patients. You've got guides, fact sheets, there are online support groups.
That sense of community.
Yeah, knowing you're not alone.
That's so important. This has been incredible. We've gone deep on ED, from the physical to the treatments, the emotional side of it all. It's clearly not a simple issue.
It's not. It's multifaceted. Needs a holistic approach to treatment.
No one-size-fits-all solution.
No.
But there's a whole spectrum of options available.
There are.
It's about finding what works.
Exactly. And I think the biggest takeaway is that it's incredibly common, treatable, and there's no shame in asking for help.
Love that. Knowledge is power. And taking charge of your sexual health can make a huge difference in your overall happiness, well-being. So, to wrap things up, I want to leave everyone with a thought. If you could wave a magic wand, create the perfect ED treatment, what would that look like? What advancements would revolutionize how we approach this and help men live their best lives?
That's a great question, something to think about as we continue to learn to explore new possibilities.
Absolutely. We've just scratched the surface here. Thanks for joining us on this deep dive, and until next time, keep exploring.